Welcome back now to WKYT's Kentucky Newsmakers. Our guest this week is Congressman Andy Barr, Republican of Central Kentucky. COVID-19 rampant in the U.S. again despite the development and distribution of vaccines. How to handle that is controversial nationwide. Here in Kentucky, Governor Beshear says more Kentuckians are in the ICU with COVID now than ever before. Congressman, it's a tough situation that the country is facing right now. Has enough been said about vaccines in your view?
Well, I voted for Operation Warp Speed, which I think was one of the most successful medical public-private partnerships in not just American history, but world history. We were able, through the generosity of the American taxpayer and the ingenuity and innovation of the American private sector and the biopharmaceutical industry, to bring from zero to approval under an emergency use authorization less than a year, multiple safe and effective vaccines. And so I was proud to support that through the CARES Act, the Operation Warp Speed, the previous administration's, I think, greatest success in combating COVID. And in terms of the original strain, the Wuhan strain, not the Delta or the Lambda, but that vaccine was what defeated the original phase one of this disease, of this pandemic, and was the key contributor to reopening our economy and getting our kids back to school.
You do not support mandating vaccines or mandating masks, right?
No, I don't think mandates is the way to go. I think a public education campaign about the safety and the efficacy of these vaccines is, I think, the way to go.
Could more have been done in that regard? I mean, there's a lot out there on the safety and the science, right?
Well, right, and look, there is a lot. There's a lot, and what I would say to my viewers or anybody who's skeptical about what I would call the Trump vaccine, the Pfizer, Moderna, Johnson & Johnson vaccine, the Operation Warp Speed that I voted for, is there's more safety and efficacy data on this vaccine than almost any other vaccine in human history. I know a lot of people are waiting for the FDA to give final approval for this as opposed to the emergency use authorization, but the FDA has plenty of data.
You called it the Trump vaccine. You know, does this have to be so political?
Well, it shouldn't be. It shouldn't be political, but, you know, it was a bipartisan congressional piece of legislation that was supported by a Republican president, President Trump, and then the private sector. So really, you know, everybody involved and the American people as taxpayers who contributed to this, we should all take credit for it and recognize that the United States of America, for all the bad news out there right now, the good news is that the United States of America, and particularly the taxpayers and the American private sector through innovation and ingenuity, really defeated this virus. And the only reason why we have this rise of variants is frankly because the rest of the world hasn't been vaccinated. We have an open border, and so Delta has come in to our country. But the good news is
we have counties in Kentucky, though, with less than 40% vaccinated. Right?
Well, that's true. And again, the education process needs to continue. And I do encourage people to take a look at this vaccine and decide for yourself. You're an adult. But what we also know, and it's important for our viewers, your viewers, and my constituents to know, that the vast majority of the folks in ICU in our hospitals right here in central Kentucky are unvaccinated. And it goes to show that these vaccines are very safe and very effective.
You're on a committee that is looking into the origins of COVID-19. What is your goal on that committee?
Well, look, we need to get to the bottom of how this started and hold the Chinese Communist Party accountable. The lab leak theory has become more and more likely. Just as we said early on, many in the media and many supporters of the current president dismissed this, but as more and more evidence has come out, it's pretty clear that whether it was a deliberate bioweapon or whether it was just negligence, that there was a release. The evidence is mounting on that. We do know, regardless, that the CCP co-opted the World Health Organization to cover this up and enabled the spread of the disease. And the Chinese Communist Party needs to be held accountable. We produced in the House Foreign Affairs Committee a updated report that shows the mounting evidence for the Wuhan Institute of Virology as the origin of COVID-19. Some people don't want to pay attention to that. I think it's critically important because we need to hold the Chinese Communist Party accountable for this terrible catastrophe to both public health and our economy. And I'm working on legislation in my capacity as the chairman of the ranking member of the National Security Subcommittee on the Financial Services Committee with oversight over sanctions on a tough sanctions bill on China to hold them accountable for this.
Do you think you can get access to the information you need on that committee?
Well, we've had access on both the National Security Subcommittee and also the Foreign Affairs Committee. We've had access to both classified and unclassified briefings. We recently released a report, unclassified, that the American people review, and again, the evidence is very solid that the Chinese Communist Party is responsible.
You have also tied some of the COVID challenges into illegal crossings of the U.S. southern border, although there's also a report that there have been record apprehensions there. When will Congress and the administration finally look at the immigration picture, the big picture, and come up with some reforms that might solve some of those issues that really haven't been touched since the 90s?
You know, I voted for a bill when we were last in the majority, when Republicans were last in the majority, that would have taken a comprehensive approach, dealt with the guest worker problem that we need to fix for central Kentucky in our agriculture sector, look at high-skilled immigration and make sure that we're enhancing U.S. competitiveness with that, but also securing our border. And unfortunately, that did not become law. But now we have this disastrous open border policy from this administration, and the American people and my constituents are crying out and saying we've got to end this hypocrisy, the hypocrisy of saying we want to take COVID seriously and impose mask mandates and vaccine mandates. But when it comes to the southern border, allow all these people to come into our country who are coming from Delta variant and Lambda variant hotspots, not test them for COVID, and then as part of catch and release them into the interior of the country unvaccinated and untested. And so why do we have a rise in the Delta variant? This is probably not the exclusive, but a factor in why we have a rise in the Delta variant. And look, I don't think the American people should tolerate a situation where they, as vaccinated American citizens, get tested for COVID as a condition for them coming into the country. But if you're an illegal migrant, you don't get tested. And you're released into the interior of the country. The Customs and Border Protection folks are seeing a spike in COVID among their people because of all the COVID positive migrants that are coming across the border.
The economy seems to be, having fits and starts, but recovering from the situation. And in some cases, some sectors are strong. The jobless numbers came in this week, the lowest in some 17 months. One thing that was to address that was the American Rescue Plan Act passed by the Democrats. Kentucky's getting billions of dollars from that. $120 million in Lexington that they're trying to figure out how they're going to apply that. More than $9 million each in Richmond and Georgetown. You opposed that bill. Would you have voted for any amount of money to come in another bill if you could have worked that out, or did you think this was the wrong approach?
Well, I think your viewers know that I'm a fiscal conservative, and I think it's telling that Lexington doesn't even know what to do with this money. I mean, here's the bottom line is that bill followed $4 trillion of mostly borrowed funds in 5 bipartisan bills that I supported in response to COVID. We had done Operation Warp Speed. We have done the personal protective equipment. We had done the PPP program for small businesses. We had done enhanced unemployment. And we had recovered, and vaccines were made available. Distribution was happening. And President Biden proposed this bill. Less than 9% of it was for COVID relief. Less than 9% of it was for public health, for vaccine distribution, for equipment or anything related, anywhere remotely related to COVID. Most of it was a progressive wish list that had been sitting on the shelf waiting for the opportunity. There was billions of dollars, hundreds of billions of dollars to bail out blue states, mismanaged blue states for unrelated COVID liabilities. There was an additional round of enhanced unemployment that created a huge problem in our labor market. And central Kentucky businesses have been asking me for months to end these enhanced unemployment benefits, which are in effect paying Americans not to work after we had reopened the economy. And so it's really tragic, all of this spending, this $2 trillion of deficit spending on top of the $4 trillion that we had already focused on COVID. And this is why we have an inflation problem.
Do you support the infrastructure bill that got bipartisan support in the Senate? It's $1.2 trillion. It's coming to the House. Will you get a clear vote on that?
I don't know if we're going to get a clear vote on that because Speaker Pelosi says she's going to condition that bill on passing the $3.5 trillion in additional borrowing for what they call human infrastructure, the Green New Deal, unrelated social spending, and what I would call a socialism agenda.
If you get a vote on the $1.2 trillion, will you support it?
Well, I've got some concerns about it. I've got questions about it because it gives unprecedented authority to the Secretary of Transportation to impose new taxes. It's overly weighted to the urban areas. There's more money in there for mass transit and urban priorities than there is, including in the broadband expenditures directed toward the urban areas as opposed to rural states like Kentucky. So I'm open to it. I've got a lot of questions. I'd like to see it amended. But only 1/10 of even the bipartisan bill is for roads and bridges, and I think that's insufficient. And I also think that adding another $250 billion to the deficit when we could be relying on more regulatory streamlining is a better way to pay for it.
I got a few seconds left. State legislature will do redistricting. Clearly, the 6th district has gained population. You'll have to shed some. The 5th district lost. There'll be some lines redrawn. Do you have a preference on how your district shapes up?
Well, I want a 10-year map that can withstand scrutiny in both state and federal court. I want it to be a legal map, and I don't want it to be subject to a challenge. And number two, I want the district, and again, this is something that the legislature in Frankfurt is responsible for doing. It's not done in Washington, so this will be done in Frankfurt. But I would prefer to have the 6th congressional district, even though we have to lose about 33,000 people according to the census numbers, to retain a central Kentucky bluegrass region character, meaning Toyota, the University of Kentucky, the bourbon industry, the horse industry. We want a bluegrass congressional district.
And you are running for re-election.
I am. We've got a lot of crises, the inflation crisis, the national security crisis, the border crisis, and I want to help take back the House to provide a check and balance to this administration.
We'll be back on Kentucky.